Hello everyone, today we will be studying about the randomized control trial. The basic steps of the randomized control trial is DSR MFA. So D for drawing up a protocol, S for selecting the difference and the experimental populations, R for randomization, M for manipulation or the intervention, follow-up and assessment. Drawing up a protocol. The protocol specifies the aims and the objective of the study. C for the criteria for the selection of the study and the control groups. S for the size of the sample, and the P for the procedures and the treatments to be applied. S for standardization of the working procedures, and the E for the evaluation of the outcome of the study. Once the protocol has been evolved, it should be strictly adhered to throughout the study. Now, selecting the reference and the experimental population. Reference population. It is the population to which the final findings of the trial, if found successful, is expected to be applicable. It may be geographically limited or limited to the persons in the specific age, sex or the social groups. Now, next is the experimental population. It is derived from the reference population. It is derived from the reference population. It is the actual population that participates in the experimental study. R for it is randomly chosen from the reference population so that they has the same characteristics as the reference population. Now there are some of the criteria that needs to be fulfilled to participate or volunteer. That is CRQ. C for they must give the written informed consent. R for they should be representative of the population to which they belong. Q for they must be qualified or eligible for the trial. Now, randomization. It is the heart of the clinical trial. It is the statistical procedure by which the participants are allocated into the group, usually study. That is the study or the control groups, either to receive or not to receive any experimental interventions. Okay, now it is an attempt to eliminate the bias and allow the compatibility, and it can be usually done by using the table of the random numbers. Now, manipulation includes either application or the withdrawal or reduction of the suspected causal factors as laid down in the protocol. Example, sugar. Now, follow-up means it involves the examination of the experimental and the control groups both. Okay, and in the SIC, that means in the defined interval of the time, S in the standard manner, and C in the same under the same given circumstances. Now, some loss to the follow-up are due to either the death, migration, or the loss of the interest. This is known as the treason. Now, assessment can be positive or the negative. Positive means the benefits of the experimental measures such as the reduce in the incidence and severity of the disease, and negative, there may be that is the severity and the frequency of the side effects, the complications, or